here to present my topic, Magnetic Resonance Hysterosalpingography, the Diagnostic Workup of Female Infertility. Let's discuss about the diagnostic accuracy, patient comfort and the clinical utility of both MR and the conventional HST methods. First of all, what is HST? It is an examination of the uterus and the fallopian tube to evaluate the problems associated with the female infertility and the recurrent abortions. This is the female reproductive tract anatomy, where the process is going to be done. Introduction. X-ray HSC is a gold standard for the tubal pathologist, but it exposes radiation to the patients. MR HSC is a new innovative technique, non-invasive imaging technique, which evaluates much better than the X-ray HSC without the X-ray exposure. Moreover, it causes less pain and discomfort to the patient. Indications: tubal patency test, uterine abnormalities like fibroids, recurrent abortion, before or after any tubal surgeries and congenital problems. This is the blockage in one side of the fallopian tube, so there is no flow of contrast media, so this is one of the indications. And the fibroids in the uterine cavity. This is one of the congenital problems for the infertility, which is double uterus. Contraindications: any possibilities of pregnancies, active pelvic infections, presence of metallic implants, and in contrast allergy. MRI HSG, as we know, it is an advanced non-invasive imaging technique to evaluate the female reproductive tract. It uses gadolinium-based contrast media to provide a 3D high-resolution images, most importantly without the use of ionizing radiation. Patient preparation. This procedure should be performed in the follicular phase, which is in 7 to 12 days of the menstrual cycle. Course of antibiotics is given to the patient before the procedure, and the previous medications of the patient must be examined. The patient is instructed to take shower, avoid using vaginal creams, wear the hospital gown, and remove all the metallic objects beforehandedly. During the procedure should be explained to the patient beforehandedly and get written consent from the patient. And sedative medications are given if necessary, and the patient is placed in the lithotomic position. Lithotomic position is nothing but the patient lies supine position on the examination table and the lower limbs are flexed at the hip and knees. The buttocks is placed at the table edges. Then the vagina is cleaned with the antiseptic solution and widened with the help of the speculum. Hold the cervix with the tenaculum and the catheter is inserted into the cervical canal. In conventional method, 5 to 6 ml of iodinated contrast media is slowly administered and the tube and uterine cavity is allowed to fill with the contrast media. After filling, the spot films are taken with the help of the fluoroscopic unit at the required phases. This is the method in fluoroscopic table how the procedure is getting done. This is the lithotomy position. The procedure is getting done with the help of the fluoroscopic unit. In MRI method, after widening the vagina, 5F balloon catheter is inserted into the vagina and 20 to 50 ml of gadolinium solution is administered slowly, and then the patient is walked freely for 15 minutes for the even distribution of the contrast media throughout the uterine cavity. Then the images are taken at the different phases using the MRI unit. This is the images taken using the MRI unit. So this is how the contrast will flow through the female reproductive system. After ejecting into the uterine cavity, it enters the fallopian tube and flows through it. If there is any blockage is present, it will not move further. Then we suspect there to be a blockage in the fallopian tube. Complications. Any allergic reactions to the contrast that is used in this procedure may occur. Mild crampics, infections, any vaginal bleeding may occur. After care, the patient should keep under observation and informed about the vaginal spotting for 1 or 2 days. The patient is instructed to drink plenty of water to flush away the contrast media that is used during this procedure, which is the most important thing. And after the vital signs getting normal, the patient is allowed to leave the examination.